It has been nearly 2 years since coronavirus caused an outbreak of respiratory disease, COVID-19, and pneumonia in Wuhan, China. By now, you probably know more about viruses than you ever wanted to. But we are still learning more every day. Find out what doctors recently say about COVID-19. Number 1. Coronavirus can make babies seriously ill. Compared to adults, children appear much less likely to get sick if they contract the novel coronavirus. However, the very young, less than 1 year, appear to be more vulnerable to serious illness than older children. From the records of 2,143 Chinese children, nearly 11% of sick infants were seriously or critically ill, compared to 7% of children ages 1 to 5 years. In the United States, from February 12 to April 2, 2021, less than 2% of cases were in children younger than 18 years. Of these pediatric cases, 15% were in children under 12 months. Number 2. People who don't have symptoms can spread the virus. The CDC estimates up to 40% of infected individuals do not experience symptoms. That's good news for the affected individuals, but bad news for public health, because asymptomatic people can unintentionally spread the virus to others. This is why vaccination is so important. Public health officials are asking all people to dramatically limit social contact to prevent the spread of disease. Wearing a cloth facial covering when you go to a public indoor place protects others because you could be infected and not know it. Wearing a mask reduces the risk of unknowingly spreading the virus to others in the space around you. Number 3. People with type A blood may be more susceptible to infection. A Chinese study of 2,173 individuals who were hospitalized with COVID-19 found that the proportion of sick people with type A blood was significantly greater than researchers would expect, based upon the percentage of people with type A blood in the general population. The study also found that there were fewer sick people with type O blood than would be expected. Genomic studies of patients from Italy and Spain have supported these findings, showing a higher risk of developing COVID-19 respiratory failure in patients with type A blood. Number 4. Reinfection is possible. If a person gets COVID-19, are they immune to future infection? And how long will immunity last? You can be infected more than once with the pandemic virus. The risk of reinfection varies from person to person. The risk increases over time since the first infection, and also depends on the specific strain or variant of COVID-19 the person is exposed to. In general, natural immunity and protection from reinfection is thought to last 6 to 12 months, but it can occur earlier. Number 5. Vaccination is very effective in preventing severe COVID-19. There are 3 vaccines that provide immunity to COVID-19. All 3 vaccines are about 90% effective in preventing severe COVID-19 caused by the Delta variant, the predominant circulating strain. The vaccines were 100% effective against severe disease caused by the original virus. To maintain a high level of protection against variants, everyone 18 and older should get a booster dose of vaccine. Adolescents ages 16 to 17 years can also receive a booster dose of the Pfizer-BioNTech COVID-19 vaccine. Number 6. There's currently no evidence that antimalarial drugs can treat or prevent COVID-19. The main clinical trial trying to find an effective treatment for COVID-19 stopped its investigation into the antimalarial drug, hydroxychloroquine, in summer 2020. This was after it found no evidence that the drug could prevent people from needing ventilation or dying, or speed up their recovery. Other trials are currently ongoing to find an effective treatment against COVID-19. Number 7. You can get COVID-19 no matter how sunny and warm it is. Exposing yourself to the sun or high temperatures does not prevent or treat COVID-19. So, whatever the weather, you should follow the official advice to protect yourself from the virus. Getting out into the sunshine, if you can, is still a good idea as this helps your body produce vitamin D, which is important for your immune system. Number 8. Drinking alcohol doesn't cure or prevent COVID-19. In fact, drinking alcohol can weaken your immune system. It's recommended that adults limit their alcohol intake to stay healthy. Drinking high-strength ethanol, as found in some cleaning products or hand sanitizers, can be very dangerous. You must not consume these products. They will not protect you from COVID-19, and instead drinking these products could cause disability or death. Number 9. What about a third dose of vaccine? Some people have very compromised immune systems, and so do not mount a full protective response against the COVID-19 virus even after getting 2 doses of an mRNA vaccine or the J&J vaccine. For these people, getting an additional shot will boost their immune response so that they can be better protected. Further data will guide us on what the most effective COVID-19 vaccine series is in various age and risk status groups. This is the same policy we follow with all vaccines, and is guided by the Advisory Committee on Immunization Practices, or ACIP, through the immunization schedule for adults and children. Number 10. Treatment for COVID-19. Most of the time, COVID-19 treatment includes treating the symptoms, which can be done at home. It's often similar to treating influenza, the flu, or cold symptoms. For people at risk for severe disease, their doctor may prescribe additional treatments such as monoclonal antibodies or oral medication. Stay home. If possible, stay in a separate room from others in your house. You want to stay away so you don't make anyone else sick. Contact your doctor. They'll tell you what to do to treat your symptoms. Thanks for watching and hope you find this video useful. Don't forget to like, share and subscribe to help reaching other people.